Welcome to Integrity Linguistics Institute.
Okay, so now let's take a look into the paragraph over here. Okay, so what I'm going to do is I'm going to help you to understand how your mind should work. Okay, so I'm not giving tips on finding answers to the questions. Again, remember, when it comes to time management, you must be able to understand the gist of the message. Right. Now let's read the very first sentence over here. Now let's understand the very first sentence. An irrational fear or phobia can cause the heart to pound and the pulse to race. Okay, so what is the writer saying over here? What is a phobia? So the phobia is, so here there the writer in the very first sentence, the writer is giving a definition of what a phobia is. So what is a phobia? See, or basically means what? Also known as. Okay, so we for example, or okay, so for example, you can call me Raju or Ramu. Okay, so what does it mean? You can either call me Raju or you can call me Ramu, right? So over here, okay, phobia is the same as irrational fear. Okay, so the writer in the very first sentence, so they're trying to say an irrational fear or a phobia. So phobia is what? An irrational fear. What is the meaning of irrational? Means it is illogical. Okay, so for example, you have to like, okay, illogical fear. Okay, so for example, if you see a lion, you will be scared. That is a law. There is a logic to it, right? So if you see a lion, if you're feeling scared, yeah, that is a logical fear. But if you're seeing a piece of paper, okay, you're seeing a mirror and you are scared, there is no logic into it, right? So it's an illogical fear. So that is what a phobia is. Phobia is basically an illogical or an irrational fear. Okay. And this has very serious effects on the human body. So a person who's suffering from phobia can cause the heart to pound. Heart to pound basically means what? The heart beats faster and the pulse to race. That means the pulse will actually increase a lot. And this can lead to a full-blown panic attack. And yet the sufferer is not in any real peril. Now see, from the first sentence, what is the writer trying to say? The writer is trying to say that this phobia, that it is basically an irrational fear, and even though the person who's suffering this phobia is not in any danger, peril basically mean danger. Okay, so the patient, even though the patient is not in any real danger, okay, the patient will experience a full-blown panic attack. That is the message the writer is trying to tell in the first sentence over here. Right. Now the person is saying, all it takes is a glimpse, for example, a spider's web for the mind and body to raise into a panicked overdrive. Now, what do you understand from the second message? From the second sentence, what is the gist of the message over here? From the second sentence and the first sentence, we understand that just a glimpse basically means what? Just one small glance. Okay, just one small glance or one small look. Okay, look. Okay, all the patient needs to do is just look unto a very random thing. Okay, so spider's web is a very random thing, right? So the person who's suffering from phobia, if they see one tiny thing that they're scared of, then that is going to lead into a panicked overdrive. Now, see the powerful words they're using. Now, see, we have anxiety, right? So, see, for example, we have nervousness, and then more than nervousness, we have anxiety, and more than anxiety, we have panic. Okay, so there is a scale of, so panic is the end stage. Okay, so we all feel nervous. Okay, so little bit above nervousness is what? Little bit above nervousness is anxiety. It is little bit more powerful nervousness. And anxiety, even more powerful than anxiety, is basically panic. So it's a very dangerous thing. Panic is a very, very dangerous thing. Like people do crazy things in a moment of panic. It just takes 1 or 2 seconds for them to, do extremely, dangerous things when a person is suffering from panic. Okay, the mind, we lose control of everything. But the writer is trying to say a person who's suffering from phobia, just one small tiny thing is enough for them to enter into a panic mode. So the gist of the message is they're trying to say phobia is actually a very dangerous thing. Okay, it may seem very simple to others, but the person who's suffering it, for them, it is a very, very big issue. And even a tiny thing can make them enter into panic. So they are talking about the seriousness. See, like this, you must be able to understand the gist of the message. Right. So again, it is not about memory. I'm not asking you to memorize first question, first sentence, second sentence. I'm asking you to trust your logic. Okay. Asking you to trust your logic and understand what the writer is trying to tell you. Right. Now let's come to the third sentence. Okay. So on the first paragraph, I will talk in detail. The remaining paragraphs, I won't talk in too much detail because I don't think we'll have that much time. Otherwise, till 10:30 something, I can go maximum. Right. So now that's come to the third sentence. Now the third sentence, the writer is trying to sell these fears are difficult to conquer. Now the person is saying, okay, this is not very easy to overcome. Conquer means overcome. So these fears, they are not very easy to overcome. And he is giving an explanation why, although there are no treatment guidelines. So see, there are no professional treatment guidelines specifically about phobias. The traditional way basically means what? Common way, not the professional way, but the common way, the unprofessional way of helping the sufferer. Sufferer basically means the patient suffering from the phobia, is to expose them to the fear numerous times. So for example, if a person is having a fear of spider's web, okay, so let's say that Ramu over here, okay, Ramu over here is really having a phobia of spider's web. So what is the treatment? What is the traditional way of treating this patient over here? It is to expose Ramu to the fear several times. So this is so Ramu, they're telling, okay, you're scared of spider's web, right? So the only treatment is every single day you have to go and expose yourself to spider's web numerous times. So every single time, what is going to happen? He is going to enter panic mode. Okay, day one, he sees a spider's web, he is going to enter panic mode. Day two, he is going to see the spider's web. Day two also he'll be panicked. Day three also he'll be panicked. Day four also he's going to be panicked. So he's there saying there is no professional treatment guidelines, but this is the traditional way. Now the person is saying through the cumulative effect. Cumulative basically means what? Combined effect. Okay, so day one plus day one plus day two plus day three plus day four. Okay, so this is what we call as a combined effect. So all these 4 days together, we get a combined effect, right? And that combined effect is what we call as a cumulative effect. So this is why that vocabulary range is important. Okay, so here they're telling through the cumulative effect of these experiences. So if we take a look into all the experience, so day one, day two, day four, so all 4 days of experience, the theory is, okay, so here it is just a theory, okay? The theory is sufferers should eventually feel an increasing sense of control over their phobias. So on day one, he's seeing a spider's web, he'll be very, very panicked. Day two, he'll be a little bit less panicked. Day three, little bit lesser panic, and day four, even lesser panicked. So since every day he's seeing the same thing, is extremely scared about, the theory is, okay, so this is not reality, this is just a theory. The theory is the person will get an increasing sense of control. Right. So what is the writer trying to say over here? The writer is saying phobia is a very, very difficult thing to live with. Even a tiny thing can make patients enter into panic mode. And unfortunately, there is no pharmaceutical intervention. There is no there is no proper way of treating. One theory is, okay, traditional way is a theory is to expose the poor patients to the things that they're extremely scared of and hoping. So it is just a hope. Okay, so hoping that one day that they will have more control over their fears. So here they're talking about a hope strategy. The writer is trying to say for a very dangerous thing. Now see, I'm talking about the gist over here. So what is the gist over here? The gist of till now what the writer is trying to say, for a very dangerous mental health condition, we are having a hope only. Okay, we don't have a proper treatment. All we have is hope. Hoping that just a theory. All we have is a theory that patients may get some control over their fears. See, that is the gist of the message, and you must be able to understand that. Okay? Especially now when it comes to OET, we have this type of questions, and for them, you definitely need this skill. Now, anyway, let's come to the last thing over here, the last portion over here. Now, the person is saying for some people, okay, for some patients, the process is too protracted. Okay, so protracted, I'm not sure how it, okay, so how about narrow? Okay, so do you understand the meaning of narrow? Means opposite of wide. So for example, narrow bridge. Narrow bridge basically means what? So for example, when you're driving, so it's a very big road you're driving, but now you're entering a very narrow road, a narrow bridge. So narrow basically means what? A very tiny way. That is what we call as narrow. So that is the same meaning as protracted. Okay. So over here, it is a protracted. That means it is just a very narrow mind approach. So this process, that is exposing people to their fears numerous times and hoping that they will get some control over here. That approach is a very protracted, this is a very narrow way of thinking. But there may be a shortcut. Now the person is saying, again, this is a contrast marker, but the writer is saying there may be. Okay, so there may be a shortcut. Now see, shortcut basically means what? A quicker way. Now see, here the traditional way is to wait for so many days. Now see, minimum day 1, day 2, day 3, day 4. So many days they have to wait. This is the traditional method, right? So the traditional method is a very long cut. It's taking too much days. But the writer is saying over here, there may be a shortcut. Okay, so the person is saying, for some people, this process it's too protracted. It's a very narrow approach and it takes too much of time. But there may be a shortcut. Shortcut for what? Shortcut for increasing their sense of control. Okay, so not for curing OET, not for curing phobias. Okay, shortcut. So you must be able to make this connection. The writer is trying to say there may be a shortcut, not for curing their disease, but for them to help a control over their fears. So let's see what that shortcut is. Now the writer is going to say the what that shortcut is. So let's see what that shortcut is. So now he's trying to say drugs that work to boost learning. Okay, so there are some medications that we give people to improve their learning. Okay, these drugs may help someone with phobia to detrain their brain, losing fearful associations that fuel the panic. Now, see here, the writer is trying to tell there is another hope, I would say. Now, see, what's the word over here they're using? There may be. Okay, so here they're telling, here also he's using may help. So they're talking about a chance. So this is another theory over here. So what's the theory over here? The writer is giving their own theory, right? So this is the writer's theory. Okay, so this is the writer's theory, but this is, so this traditional method. Traditional method is other people's theory. So here the traditional method is that is exposing the person to the fear numerous times. So they are talking about other people's theory. But here the writer is giving his own theory. So according to the writer's theory, he is saying there are some medications, that we give to boost learning. Okay, that is to help people learn faster. So if we give these medications to a person who's suffering from phobia, it will help to detrain their brain. Okay, so opposite of train. So for example, train basically means what? Practice, right? Practice. So what is the meaning of detrain? Detrain basically means what? Forgetting what they practiced. That is the meaning of detrain. So for example, I'm training you all on OET. Now, if you go to another inefficient trainer, okay? So I believe I'm an efficient trainer. Now imagine that you're going to an inefficient trainer and you're studying under that inefficient trainer for 3 months. What is going to happen? Everything that I have told you, all the wisdom and knowledge I gave you, you will forget it because yours, what is happening there? A detraining is happening. So similarly, let's imagine that a student who was under an inefficient trainer for 3 months, okay, a student who was studying in an inefficient academy for 3 months, they're coming to my academy and I am training them in the right way. So what is happening? I am actually detraining their wrong training over there. So they got a lot of wrong information, but coming over here, I'm giving them the right information. So what is happening? I'm helping them forget the useless information they studied earlier. So that is what we call as detraining. Right. So here the person is saying, if a person is suffering from phobia, okay, there is another theory, okay, a theory. What's the theory? There are some medications we give people to learn, to boost their learning. So if these medications, if we are giving to people suffering from phobia, okay, then there is a hope. There is a small possibility that these patients will forget, okay, will forget that they are actually scared of that one particular thing. That is a detrained. Their brain will become detrained. And if the brain forgets that they're scared of fire webs, so when the patient is looking to the spider web, the person is no longer, you know, having that fearful connections, fearful association that fuels the panic. Okay. So this is what the gist of the message is. So now let's understand the entire gist of the message. So the main message that is coming over here is phobia is a very dangerous condition. Okay, so maybe I'll just type it over here. Okay, so the gist of the message over here is phobia is an extremely dangerous mental condition, right? So extremely mental condition. We don't have any treatment. All we have are theories that may or may not work. This is the gist of paragraph 1. Now see this entire paragraph. Now see this entire paragraph over here. So there are like how many sentences? There are 6 or 7 sentences, right? So this 6 or 7 sentences we can combine into just one single sentence. And that is what we call, this is the main message. So this is the main message the writer is trying to tell us. The writer is trying to tell us that phobia, it is not a simple disease. People may laugh at people who have phobias. For you, when you see a spider's web, it is completely normal. But for a person who's suffering from phobia, it is not at all normal. They may go into panic. Okay, so panic is an extremely dangerous. So those who suffered panic attacks, they know how dangerous it is. It is one of the most crueling thing a person can experience, right? It just lasts for few seconds. So I personally have experienced panic attacks. Panic attacks will last only for few seconds, just less than 20 seconds, less than 50. But that 20 seconds, no, you will do crazy things. If you're on the top of the 15th floor, you'll feel like jumping, you will jump down. That is how dangerous that 15 seconds of panic is. Okay, so panic attack is, so you're all medical professionals, you must know, panic attack is not a small thing. Just 15 to 20 seconds only to last, but that 20 seconds, extremely worrisome. Right, so here the person is saying a small thing can trigger panic attack. So it's an extremely dangerous condition, and unfortunately, there is no treatment. All we have is just hope. We're just having a hope. We have just two theories that may or may not work. So this is the gist of the paragraph 1. So this is what the writer is trying to tell you over here. Right. So what will be the answer to the first question? What is the main message of paragraph 1? So exposure therapy can completely cure all phobias. So is that true? No, right? It cannot cure. It is just a hope over there. So we cannot choose answer option A as the right answer because there is no cure. There is no treatment. So there is no cure. What about answer option B? Phobias are powerful irrational fears. Now see, they are very, very powerful irrational fears that are extremely hard to overcome, but the drugs that enhance learning might make treatment faster. Now, see, it is just a strategy. It is just a hope. There are some medications, so it may make the treatment faster. So we can say, yeah, this could be the gist of the message because it is not, it is, we are getting the answer closely related to that. Now let's come to answer option C. The main reason phobias persist is that people do not face their fears enough. So is that the gist of the message? No. Okay. So are they talking about the main reason why phobias persist? That is not mentioned. Okay. That is people do not face their fears. Is that the reason why people are scared? No, right? So that is also an incorrect answer option. What about D option? Fear is imaginary and can be easily controlled with willpower. Completely incorrect, right? So we cannot choose C. So the answer option over here is B option, right? So the answer options over here, the intention I'm trying to give you, the main message I'm trying to give you is you have to understand the gist of the message. That is the training I'm giving you in. right? So that's the reason why I made a small MCQ draft over here to make it a little bit more straightforward. Now, what I'm going to do is I'm going to show you another small document. But before that, okay. Now see, these are all headings over here. Now for the first paragraph, which heading will you give? Okay, so let's say this is answer option A, this is B, this is C, this is D, this is E, and this is F. Okay, so these are all headings. So for the first paragraph, which heading will you give? Again, if you're going to give a heading to the first paragraph, which heading will you give? The first paragraph. Will you go A, B, C, D, E, or F? This is an easier one, right? Because we are still in the first paragraph. Right. Very good. Okay, so we will give answer option C, right? So C is what we will give, right? Because what's the writer trying to tell us? What's the gist of the message? The gist of the message is the challenge of treating phobias. So here he is telling phobia is a very dangerous condition and there is no treatment, and all we have are just two theories. It may work or it may not work. So it's a very difficult thing to treat over here. So we can give that as the heading. Now see this entire sentence. Okay, this one tiny sentence over here, is equivalent to this entire information.